Welcome to Talking Impact, your go-to podcast for exploring the powerful connection between mental health, education, and resilient youth. Join us as we uncover insights and stories that inspire classrooms, stronger minds, brighter futures, and a lasting impact in our society. Welcome to another episode of Talking Impact. Today's episode is a special two-part series that was filmed at a recent event celebrating 30 years of Impact Society, reaching nearly 300,000 youth across Canada. We assembled our friends, our guests, and our supporters to have a special conversation with psychologists and educators who are on the front lines of supporting youth amid an ever terrifying youth mental health crisis. The first episode in this two-part series focuses on the medical as well as the psychological supports that are addressing the mental health as well as addiction issues that we see across our communities and in our homes. We talk about the solutions that are being done to treat and address these issues, but more importantly, we talk about how we can get ahead of the curve, what is needed in order to prevent more youth from falling into that cycle of addictions and homelessness and mental health crises. And at the same time, how we can make sure that every youth has an opportunity to build the resiliency required to navigate life's challenges and escape those cycles if and when they encounter them. This conversation focuses on a key issue within our communities and within our healthcare system is providing more treatment, more recovery, more psychology to people who are struggling with and suffering from mental health and addictions issues. But it gets to something far more interior, something far more important, which is how do we get ahead of those curves? How do we get there before risk becomes a life? How do we prevent these things from happening in the first place and equip young people with the tools and the self-esteem and resilience required to be able to navigate these things when they occur?
Hi everyone, and Dr. Mitch, and right there, Dr. Robert, and Chris. Thanks for being here tonight. So let's start with an easy question. I want to start with Dr. Mitch. What's contributing to the youth mental health crisis, and why is this moment so critical for intervention?
So we just got done talking about strengths in the previous conversation, and we're taking a sharp turn here into a mental youth crisis. And so I like just to start off just by saying to that piece is that the majority of kids are resilient. They're very strong. The mental health crisis affects those disproportionately, especially from different groups and communities that people might find themselves in, rural areas, so forth. But when we do think about the mental health crisis right now, we are seeing a rising increase. Pre-pandemic, we were sitting at about roughly, 1 in 5 kind of numbers for significant mental health needs in the youth population. Post-pandemic, we're sitting at 1 in 4. So in a classroom, you can imagine that's a major percentage of your overall group, and you have to think about what's causing that. So to your question, in terms of some of the things that's causing that right now, we're seeing the impacts of social media right now is a massive impact, and I think if anyone can agree, the perfect lifestyle that you see online doesn't do a lot for social comparison when your lifestyle is not that great. I'm still waiting for social media to come back and show me how bad things can really be sometimes, in day-to-day human life would actually be pretty refreshing, especially for youth that use that as their peer comparison. In addition to that, the other piece that we have is that the removal over time across the provinces and territories, especially in Alberta, of mental health services from education systems. It's becoming more pulled back. School psychologists and counselors in those spaces are being redeployed to other sectors, being pulled out completely. We've had some work with districts that have lost their entire psychology team, right? And you have to remember in that pyramid of intervention, we see the kids who really need to be seen, but there's a big group that the schools help us out with. That's the bulk, right? A lot of respect. So for me, I think the big piece that we're seeing here is the rise of social comparison, the reduction of systems in terms of their access to youth mental health, in addition to the inaccessibility of mental health services that are integrated into the public care system with massive wait lines and being turned away in emergency departments, right, for when kids are having trouble. I evaluated our hospitals, a number of them in my time, and I know where those kids end up, and it's not where you think they do, right? So in terms of those pieces, that's what we're seeing right now in the mental health space.
So I've heard myself that school boards are struggling with making the argument for why the mental health programming should be kept within schools. And at the same time, I've also read stories and news coverage that suggests that a lot of interventions in schools are not effective, and that maybe schools are making things worse rather than better. So my question to Chris is, what's different about Heroes, and what kind of outcomes are you seeing that point to that difference?
Yeah, I think what's so important about all the work that all of us do, we have a psychiatrist here, a psychologist, who are, looking at not just the symptoms that we see coming out on the front lines. And just like a lot of physical disease, mental health starts long before we see those symptoms. So when we're talking about 1 in 4, currently in the average school classroom, 1 out of 4 kids is currently dealing with one of those issues. Over half of them are going to have an issue at some time before they reach the age of 18. So if we're just looking at this problem on the outcome, this kid needs an intervention, this kid needs an intervention, we're playing whack-a-mole with a problem that is actually generational in nature. There's actually systemic in terms of not just the comparison, but the lack of hope. Jack mentioned that line, he said, why am I even here? I don't want to get up tomorrow. When we talk about resilience, sometimes we don't understand what does low resilience look like. And it's that I don't know what I'm doing here. I don't have anything to get up for tomorrow. And so when we talk about the schools, we need schools, we need educators, but we also need those educators to be equipped with the right tools to be able to look under the surface, to help these young people understand who they are, what their strengths are, that if they have a mental health issue, or if they're having home issues, or if they're encountering any type of risk, that doesn't need to define who they are. But when we're only looking at mental health as a crisis intervention and a rapid deployment to high severity needs, we're missing the 99. And we're not actually effectively treating that one because they're coming in with no baseline, no understanding of what makes them strong, no understanding of what walls are, what barriers, what challenges are, and how those don't define them. And so when we talk about having heroes in every school, what we're talking about is having these curricular programs that can be taught in a health class, a social studies class. They're helping to raise that baseline of resilience as well as several other mental health, positive mental health aspects so that intervention can play a better role and get there earlier and often when needed, but also that individual isn't just looking at their cell phone for comparison. They're looking in a classroom of peers and teachers who see them for their gifts and abilities, not for the issues they might be encountering.
So to that, I hear a lot of the word resilience a lot, and I'm also really interested in the word agency. So I wonder if you can speak to how you understand the Heroes program builds agency in kids and why that matters.
Yeah, I think an agency is a big term, and I'll probably invite Robert to back me up here in case I talk off book. But when it comes to agency is that ability to know that you have a certain amount of control over your decisions, over where you're going, over what you're doing. One of my favorite chapters in Heroes talks about choices. It's about stop, think, and choose. And that's within our integrity module that also deals with relationships. And who can you go to when you need help? And how can you be a person that can be sought out when you need help? And so when we talk about agency, it's about giving these young kids, and resilience has a lot to do with it because it's that awareness of my internal strengths and my external strengths, my internal resources, my external resources. So although we're not sitting there and be like, here's what agency means, and you need to pass the test, otherwise you're not gonna have positive mental health, guess what? Knowing about agency isn't what creates an agentic human, a resilient human. It's knowing who you are deep down inside, what resources you have, and how to make good decisions. Not just making decisions, but to make good decisions that you understand the past, the present, and the future. I kind of come it back to something, actually, I think it was Mitch or Dr. Nordstoke that shared this with me, and like, what's the symptom of resilience? It's meaning making. It's the ability to make meaning of your past, your present, and your future. And if that's not agentic, if that's not a hallmark of agency as well, I don't know what is.
Thank you. Dr. Robert, there's a tension, I guess, out there between recovery and prevention. or maybe not, but maybe there's perceived tension. What would you say is important from a health policy perspective in terms of supporting youth mental health and resilience?
Well, there shouldn't be a tension. I think that the concept of prevention is really about kind of what Mitch had said, is doing everything we can to care for our youth, building agency, building resiliency, and kind of preventing some of the harms of mental illness and addiction that can occur in early adolescence all the way up to adulthood. But I don't necessarily think that there's a tension. I think the reality is we're in the midst of an addiction crisis, a mental health crisis, an overdose crisis. And it's not just opioids that are going up and the toxic drugs that the media likes to play with and gets into political sound bites. But the reality is we see more use of alcohol, more use of cannabis through the roof, more use of substances. We're seeing more presentations in emergency departments. So prevention should be everything. It just so happens that our healthcare system isn't necessarily a wellness system. It's a treatment system. And this is just the way the system has been built and designed and developed. And under the Canada Health Act, it covers hospitals and doctors. It doesn't cover more important people. It simply covers people who can write a prescription. That is not the answer, but that is our society. So I don't think there's a tension as much as a societal desire to have access to the people who are sick, because that's how we perceive as our healthcare system. We need emergency departments open. I need my family doctor available to me. I need a psychiatrist when I need a psychiatrist. It's like, can we figure out how to back the truck up so you don't need any of those things?
And do you have hope that that can change?
I feel very on the spot right now. I mean, hope to me is hanging on pain ends. And yeah, absolutely. The reason I joined the board for Impact and was really, I had Chris coming out and I had met Jordan earlier as well, and came out to a conference that I was running, and spoke about everything that I think of as a parent, that I think is insane as a so-called educated parent, is my kids don't have any of those access points to build resiliency. And it's really up to the parents, but we all work so hard and do so much that we kind of feel as parents sometimes, well, this is kind of the school thing. The school's like, no, this is a parent thing. The opportunity to build that resilience inside a school, I've always said, I think kids should be experts and should be taking a CBT or cognitive behavioral class in grade 1, 3, 5, 7, 9, and 12, so that when they graduate, they have the skills. Maybe the employment of the skills, maybe not super knowledgeable, but when it occurs, they can use those skills and have some of that resiliency and agency built up. And don't get me wrong, algebra is important. History and social studies is important. Spelling, I don't know if it's important anymore. But these things are important, but so is, what do I do when my friend talks about me on social media? Because that's going to happen. I don't know if all of the statistics and algebra that I have taken really is employable in my day-to-day activity.
Yeah. So Dr. Mitch, you're the psychologist. You have a client list of young folks and parents. So what are you seeing that works?
Well, by the time they get to me, right, the thing is that in my chair, in my room, that's very nicely appointed, because I'm in just a little space, and they work with me. What's interesting is that they go home, they go back to school, they interact with their community. I'm merely a flashbulb of their entire life, right? We saw Dr. Mitch. That was cool. He has fun stuff, right? And that's pretty awesome. I like being the guy that has fun stuff and does some cool things, right? But what's interesting is, from my perspective, what tends to work is when the interventions are embedded into the systems for which they work. The first thing I was ever told when I became a child psychologist as my specialization was, I hope you enjoy working with parents, right, in systems, because it has nothing to do with the kids, right, is what the joke was for me in my training, because they said, you want to influence the adults, the educators, the parents, to implement systems and services that are going to be in the best interest to support the healthy development of their child. You can teach the child skills, which I believe 100% what we're talking about here, but I also think it's about that education of the system to be responsive to the child's needs in situ, where they are most of the day. And there's lots of indicators of mental health need that schools and communities have before they even come to me, before they end up in a hospital setting. That could be very much preventive. And ironically, the irony that I see sometimes in the prevention piece is people say, yeah, we should do prevention. But if you thought about prevention as a stock market, which I know is kind of in flux right now with the whole, stuff. But whether side, you pick you. But what's interesting about that is that if I told you there's a chance to take your money and make a 300% return up to a 900% return, anybody wouldn't bat an eye at that. They say, how do I invest, right? And ironically, that's what prevention gives you, right? It gives you a 4 to 5 time multiplier on whatever type of income that's put into prevention in terms of what impact it has in terms of reducing costs to the province, to the country as a whole, into systems as a whole. So if you want to think about a good use of your dollars, it's the dollar to prevention model. And it has shown work in other countries as well as in Canada quite consistently.
Yeah, as a parent and just a regular person who pays taxes, I gotta say that seems like it makes a lot of sense. So what's missing in the equation? Why are policymakers not saying, well, yeah, that we're gonna fund prevention instead of recovery? What's going on?
So from my vantage point, what we're seeing is that some policymakers are. So, and that's really exciting. There are examples. So I'll give you a few here. So in my role, I sit as the director representing practice for the Canadian Psychological Association, in addition to my role with the company here, Hexagon. And in that gives me a federal vantage point to what's happening in every province, territory in Canada in terms of mental health services, which is very stressful. But that being said, what it allows me to see is when things are working well, and we are seeing that some policy makers in British Columbia, as well as Ontario, and as well as Nova Scotia, are running pilots right now that are actually opening up in the provincial billing codes to allow mental health services to be billed under primary care services. Even private clinics can bill under private care, which increases access to groups and individuals that don't have access to those services, because psychological services is costly, but it's only costly because it's been excluded up to this point from the general service. And that's how they're covering their costs, right? It's any service in a vacuum has to recoup itself. So that's what we're seeing being done through a number of pilots that have shown massive success. And now there are a few provinces with the Insurance Acts open. And it doesn't mean Alberta couldn't be that exact same context. There are examples in its neighbors. Yeah.
So maybe either of you, Chris or Dr. Rob, the question of making psychological services available to folks is, as you said, is expensive. So what you're really offering is a route to some kind of, can we call it group therapy? Is that the right term? Is that what's going on with the HEROES program? Or is it something else?
I can speak to that, and I think that Robert probably can expand on just the vast complexities of mental health ecosystem and in prevention. So when we talk about our programs being preventative and in that early intervention stage, we're not talking about group therapy. Although sometimes in those classrooms, and we'll hear in a little bit, it's a little bit like group therapy. But imagine if, rather than having to have mom and dad find a psychologist because they want to make sure you're good before it gets bad, in the classroom that your 11, 12, 13 to 18-year-old was in every day, programs that were proven to be preventative, that were proven to be proactive, to build positive mental health and resilience early and often, were already there. I'm not saying we wouldn't want to, and we should have more access to some of these additional interventions early and often. But if we're able to have that as part of the education experience, from diapers to diplomas, what we'll start to see is that baseline rise up so that these early interventions, these other preventions, and these recovery models have a higher baseline. And so by raising that baseline, we have a better opportunity to not just prevent, but also intervene in the right way at the right time before it gets out of control. So that's where our programs really are different in that sense is, although we have these outcomes that are proven, longitudinal studies and amazing researchers who've worked with us for decades, and some just coming on board. What we're trying to do is to find a way, dare I say, to have a vaccine, a mental health, not something you inject in yourself. This is 12 to 20 hours of classroom time. But imagine if these kids are completing curriculum outcomes, and while they're doing that, they're also growing their mental health skills and their mental health strengths. Doesn't mean that they won't need an intervention or additional therapy and additional supports, but it means that they'll be more open and more ready and more able to rebound and continue to move forward when they do.
Did you want to add to that?
I mean, so what I'm going to try to do is take a policy approach. We're in a crisis. Step one of that crisis is a public health approach. That public health approach is basics on harm reduction. So we want to reduce the harm to those people who are actively unwell. And so that's the first step. Second step, access to treatment and recovery. Those people who are unwell, 1 in 4, 1 in 5, some data, out of Sun Life and stuff are showing even as much as 1 in 3. We need access. So, step 2 has to be, we got to move into treatment. And that treatment has to be access to everyone on demand. That doesn't exist anywhere in this country. In fact, there's not another province in the country that's even moving into treatment. Trying to find addiction treatment, inpatient treatment. Most people in this country have to go to another province. 60,000 Canadians leave every year for healthcare to another country. We need to also take a look at now when you move in, okay, now we build a system of care, and not a bunch of silos and centers of excellences that they're all over this country. Brilliant programs that people love. The problem is when you exit the program, you go back into the chaos because there's no system. So we need longitudinal systems of care from beginning to end of a pathway of treatment. Health, we focus on randomized control trials. And so randomized control trials are often pharmaceutical-led. That is our healthcare system. So most of health is, I have something going on with my heart. I go see my doctor. My doctor prescribes me a medication that's evidence-based, based on a randomized control trial that's better than placebo. Looks like it's a little more than I can handle. I'm going to send you to the cardiologist. Oh, you need a bit more. I'm going to send you to the surgeon. Back to the cardiologist, back to the GP. That's as complex as things get. That is not the case in mental health and addiction. Many people are most vulnerable, are living without home, without shelter, without income. We talk about rehabilitation. Many need habituation. They've never even been able to be habilitated to be rehabilitated. Many people have grown up on the streets. So how can we just give them a place to live and say, you're cured now? That doesn't happen. In fact, highest overdose rates in BC, California, New York are single residency occupancy, or SROs, which is basically housing first or shelter overhead. Lots of sound bites. Prevention, when we get a system up and built, now we've got to try to reduce the number of people coming into that system, right? So harm reduction, then we get treatment so we can prevent the number of people needing harm reduction. Then we do prevention to reduce the number of people needing treatment. So what impact is, and what we're talking about it at a school level, is this prevention? I think so. Is this important? Absolutely it's important. Is there a lot of evidence around how to prevent things? Remember, prevention started with, this is your brain on drugs, any questions? And many would argue that made things worse, although the data is not really all that clear if it made it worse or it didn't make it worse. You know, we did some surveys. Some people said, oh, I saw that commercial and I thought, I want to try drugs. I want to see what my brain looks like fried. So then they decided, well, that's a bad idea. So we don't really know how to do that prevention piece. A lot of prevention and under drug policy is preventing drugs to get into our society. So prevention ends up in enforcement. This kind of prevention is absolutely necessary and probably more important than anything else that we can talk about. And it's great to see Alberta leading it. Now we're seeing mental health classrooms and tens of millions of dollars going into mental health classrooms in Alberta throughout the entire province. You know, I think a lot of that concept of building. And so these kind of three pieces we can't just go in and say, we're gonna prevent. Now, don't get me wrong, I've been asked, you know, our society, I had a group saying, look, our society is as high as 60% addiction, mental illness. You know, we haven't been able to stop it. What do we do? And I said, well, I'm gonna give you a radical approach. Put all your money into every new pregnant person. And that family member to prevent that child from getting down there, because you might not change this because nobody ever has. So, but that's really radical and says we're giving up on a whole population. Right now, nobody's giving up. We're putting a lot of money into recovery because people have a right to recover. And in most provinces, it's just harm reduction and nothing else. Unless you have money. If you have money in this country, you get private treatment and private psychology and private addiction. And I get to go to $30,000 a month treatment centers, and I can spend $100,000 a year on a treatment center. That's great. In Canada, if you have money and you have addiction, you're fine. But if you don't, you're not. And this is why we have a fentanyl crisis in USA and Canada and nowhere else in the world. I want to repeat that. No one else in the world has overdoses from fentanyl. Because no one else in the world ignores their most vulnerable and does nothing to prevent this stuff from happening and does nothing to support them with mental health and addiction and housing and everything else.
Even the U.S., I thought.
U.S. as good as Canada. We're very similar, okay. Right? If you don't have a home address, you don't have Alberta Works, you don't get basic income. It looks no different than if you were living in the Tenderloin in San Francisco.
Okay. So we've got about 10 minutes left. I want to cover a couple more questions. And one is, what do you see, maybe any of you who wants to weigh in, what do you see as the real lever of change from a policy perspective, funding, whatever? What lever needs to be pulled in order to get the result? Go ahead, Chris.
I just want to pick on that term, habitualization, because that's what we're doing. And I think that there's the lever. And the cost of $45 per student to every week throughout their school year to have homework to go and create a new habit, that they're going and talking to a mentor, someone they look up to, that they're reading an affirmation about who they really are and what makes them strong, that they're engaging in just opening the door and journaling about how it makes them feel to do that little act of kindness in little ways. We're not talking about a radical treatment center inside of the school. What we're talking about is not just raising a baseline. That's too, charty, although I do like the charts. We're talking about habitualization. We're talking about a generation of kids who are going to be able to learn those habits to be able to know who they are at their best, what brings out the best in them, and who brings out the best in them. And without that, you can do all the recovery and you can do all the treatments in the world, but if you don't have this baseline, this self-dignity, this self-respect, this courage, confidence, integrity, and purpose, it's going to be an uphill battle.
Okay, so from what I know about policy, funding follows outcomes and results. So how do you speak to the results of your program, and how does it land with folks in the policy space?
We have some great partners in government across the nation. The province of New Brunswick, both health as well as education supports us. Saskatchewan, the Ministry of Education there as well. In Alberta, it's the Ministry of Mental Health and Addictions, which is doing amazing work and actually leading this country in implementing a recovery-first model and helping to ensure that people aren't just left in the streets to continue to use and eventually die. these are some of the partnerships that we're working with. In terms of the evidence, there's a lot of evidence, there's a lot of data, and I could talk all night about the different data points and what they mean. But it really does come back to resilience, because that resilience gives you, an individual, that ability to know that although they've been knocked down, although they're facing risks, although maybe they've gone from nothing to even worse, if you can boost the resilience of someone in recovery, for instance, not only is their likelihood of completing that recovery program higher, their likelihood of maintaining their sobriety for the long haul is higher, because now they have something more to live for. They've made meaning out of their past and their present, and they're now more willing to engage into that future. So there's a lot of data and a lot of evidence around what resilience can do, and I'll be the one to say it. Our outcome of 45% long-term, this is after 2 years of a longitudinal study, a 45% increase in psychological resilience. That makes the difference between not wanting to get up tomorrow because I don't know what I'm doing here and I got nothing to live for, and I know who I am, I know where I'm going, and I know it's going to be tough, but I know I can keep moving forward.
Mitch, Dr. Mitch, I'm going to let you have the last word. Can you paint a picture for us of somebody who's resilient? What does that look like? How do they behave? What's different between somebody who's not resilient and someone who is? Help us understand.
So from my perspective, resilience can take many forms, but what I typically see is an individual who is able to live in the life that we have to live in, right? That comes with the opportunities and the challenges that present themselves on a daily basis. The thing is that when we talk about building programs, there's always a perception that we're bubble wrapping kids, right? That we're removing barriers and we're trying to make them, just not have obstacles or challenges in their life. But real world does have challenges. Real world is difficult. It is hard. You will cry at times, right? It is hard, and it should be. Anything worth doing is hard, right? However, there are systemic barriers that impact a person's life, and that's where policy comes in to switch those around to kind of help create equity within groups. But when I think about what they're able to do from a resilience perspective is a person who believes and has hope in themselves. They have a hope for what they're able to accomplish to move forward. That's based in reality, that's optimistic. And they're able to manage the challenges that befront them in a way that allows them to not only survive the challenge, but to thrive through it. Knowing that thriving at times from a resilience perspective may mean you are going to fall down and scratch your knee, but you will rise again and you will continue down that path with determination, right? So from my perspective, a resilient individual is someone who believes in themselves, believes in their capability, knows that they are the master and commander of their life, know that life is going to be hard, that they have the capability to overcome, and know that they have a strong social support network of people around them who love them and care for them and can move them along down the path because we are a village, right? And we're here for each other, and that's how we move forward always as a people.
That sounds pretty good. So I think we're going to thank you all for coming tonight and participating in this panel discussion. And we're going to invite everyone here to stretch your legs, go and have some dessert. We're going to meet back here in 15 minutes, and there's another panel of educators who are going to be with us in 15 minutes. Thank you.